The Mirena IUD is quickly becoming a popular form of birth control. Women like it because you don't run the same risks as taking oral contraception. Today, more than 2 million women use it. But tonight, we explain not everyone has a good experience. Some experiencing painful and even dangerous complications.
The Mirena is an intrauterine device.
And then I started getting severe pain.
It gets inserted into the uterus.
It was horrible.
Once we feel that we're at the top of the uterus, we then open the device and then pull back and release, and then this stays in.
They told me that it needed to be removed as soon as possible.
There's strings that are attached to it.
And I would never recommend it to anyone.
When it comes time to remove it, we pull down the strings and pull it out.
It turned out to be a nightmare.
I don't.
Sarah's Mirena IUD perforated her uterus and floated into her abdomen, just like in this x-ray of another woman. Doctors performed surgery to remove it. Sarah is one of thousands who say they've had complications with this birth control. The complaint records from the Food and Drug Administration show almost 60,000 complaints since 2004. A wide range of issues, including acne, migraines, and back pain. But one of the most common complaints was listed under expulsion, where there were more than 12,000 reports of the IUD coming out. Abdominal pain is also common, with 3,774 complaints, and uterine perforation, which is what happened to Sarah, with 1,322.
Anytime you do a medical procedure, there is always that risk of chance of complications.
Dr. Angela DeRosa is board certified in internal medicine. She focuses on women's health.
When bad things happen, we always hear about it. Most of those were not serious complaints, but there's 2 million women out there who are running around with IUDs and that have had no problems.
It's amazing, so convenient.
Allie Thompson is one of those women.
Makes everything so much lighter if you have a bad period, and you don't have to worry about taking a pill every day, and it lasts for 5 years, so you can't beat that.
There are currently dozens of cases filed in federal court. 5 of them were filed by certain attorneys, but they're looking at hundreds more.
We have 900 cases in-house.
I think that there's enough evidence that there is pretty serious complications involved with this device.
Many law firms are searching for clients.
What these people aren't being told is that at any time after this device is in place, it can perforate the uterus and cause these complications.
Bayer, the maker of the Mirena, won't comment on specific lawsuits.
There's nothing in the warning that gives these individuals any idea that once they walk out of their doctor's office with this device in place, that they need to be cognizant of this risk.
In their statement, they say they take, quote, the safety of our products very seriously. For that reason, we continuously review the safety profile of all of our products worldwide, end quote. The FDA tells us no drug is absolutely safe. FDA-approved drugs show their benefits outweigh their known risks. According to DeRosa, one of those benefits includes protecting against uterine cancer during hormone replacement therapy. It also eases common menstrual symptoms and eliminates periods in a majority of patients. Sarah continues to have pain on her left side. She says the doctor told her she has nerve damage that will never go away.
I just don't want it to happen to other women. I mean, you think you're doing something to help yourself and your family, and then it just ends up turning into a disaster.
A couple of years after that ordeal, Sarah added a baby boy to her family, and you can read the complaints to the FDA in greater detail on our website. That's abcactionnews.com.